there's a bit of a predictability component to that. So if you've had a lot of events in certain situations, we are more likely to have a PNEA event in those situations. And also, I had talked a bit about the fear portion of our brain, which is the amygdala. And from functional MRI research, we see that people with PNES are more likely to have heightened pathways in the fear center of our brain. So there is a bit of a protection that happens for people with PNES.
Right. So this comment and question, so before you said it was, and I was already thinking, what came first, the chicken or the egg?
Mm-hmm.
Behavior problems, mood problems, the epilepsy, the side effects. Is there any way to help differentiate? This is the struggle with my 12-year-old. Per the neurologist, we are on a wait list for behavioral health, but it can take up to 4 months. Is it standard to start with talk therapy, counseling, and then see if they refer up to a neuropsych? Or should we be advocating for someone who has a deeper understanding of the effects of his neurological condition and its effects right from the start? So a lot of questions in there if you need me to repeat anything, but.
Yeah, I'll try to answer them one by one, but all very, very good questions. So the first question, is it the chicken or the egg? It is really difficult to differentiate that. One way that you can differentiate is if you see significant changes in mood, when there is like a change in environment, or if there's a change in your medications, or maybe they're going through something related to their epilepsy that could be changing the way that we're thinking and feeling. So if you're changing a lot of things all at once, though, that can also cause problems with adjustment disorders. So it really is a problem with the chicken or the egg, and it's really hard to differentiate. The most that you can differentiate is whether or not there's a dosage change in your medication. You can say, maybe this is related to my medication, or if the symptoms worsen right before or right after an event, then that's, again, you would think maybe that's more related to the epilepsy. But most of the time it's really difficult to differentiate. Next.
The second question was about moving from behavioral health therapy to a neuropsychologist. Should they jump right to neuropsychology?
So the way my clinic works, and I think this is pretty common for most clinics, is that we first get started in psychotherapy and individual counseling or family counseling, and then the psychologist or the mental health practitioner will then refer or recommend that they seek other treatment. Maybe that would be a neuropsych evaluation, or that would be talking to a neuropsychiatrist. So usually it starts with psychotherapy, and then the psychotherapist comes up with the treatment plan from there. That's how we do it in our clinic, and it's been pretty successful in that way.
And I have a question, actually, because I get this asked quite a bit when people are looking for therapy. And I often get asked, I want a therapist, or I get told, I want a therapist that has epilepsy experience. And of course, here at our clinic, we do have therapists that do have exposure to people with epilepsy. But in general, for others, what would you say to that?
So there are a lot of specialties that are within psychology. So many you probably couldn't even count them, but for epilepsy centers that have, for certain levels of epilepsy centers, there should be a mental health counselor within their epilepsy center, and they should, hopefully have experience treating that population. There's also a subspecialty in psychology called health psychology, where it is specifically where they're specifically specialized in chronic medical conditions. And with epilepsy being, something that affects a great number of people, that they should have treatment in that. So I would start by looking up specifically a health psychologist, maybe even one that's board certified in health psychology. And then next, there is another subspecialty called medical family therapy or medical marriage and family therapy. And often those are family therapists that also have experience in chronic medical conditions and should be able to treat patients with epilepsy.
Great. Great. I didn't know about those designations, so thank you.
Yeah, of course.
Hey, do you see an increase in people wanting to remain isolated post-COVID? For people with epilepsy, has that been more frequently noticed? Do you have suggestions for moving forward from this for our clients and families?
I would say that this is not just a problem for people with epilepsy, that this is something that's happening in the world. Our whole social lives changed during COVID, and COVID was not something that lasted 2 weeks. It was something that lasted years. So we're seeing that isolation is happening all over the board, but especially people with epilepsy, there is that risk that if you get sick, you might have more epileptic attacks. So I could imagine that the fear that getting sick could keep us inside more often. And, you know, I know this is not part of your question, but one other thing that we have seen during COVID is in our epilepsy center, at least, and I don't have the numbers on this, this is just from observation, is that we've been having more cases of functional non-epileptic attacks as well. And I think that is, you know, with COVID, it was just a very, very stressful situation for most of us. And, you know, it had long-standing social impacts for sure. Next part of that question. Okay, do you have suggestions? So moving forward from this, as I had mentioned, there are those long-term coping strategies. And one of those is the exposure piece. And when I say exposure, you know, if you're somebody who likes to stay inside, I would not recommend going to a concert as your first exposure. I would recommend doing something that's comfortable to you. Maybe it's going to a park or going to a small birthday party, something that, you know, if you were to think about what would be the least threatening, starting there, and then over time exposing yourself more and more, and then that can actually help that fear center of our brain relearn what is dangerous and not dangerous, and then you can start to actually enjoy your life and feel like it's a bit more valuable.
Great suggestion. Thank you. I am not seeing any other questions at this moment, but thank you very much for your talk.
Yeah, of course. Thank you all for having me. And, you know, feel free to reach out to me at any time. I really enjoy helping and working in neurology. So thank you.
I'm sorry. There is
That's
one.
okay. I'm here. I'm ready to talk.
I didn't want to ignore it. I'm sorry.
That's fine.
Let's see. Okay. My 28-year-old has all that you have talked about. And he gets shots every month for his mood. I worry about him because every seizure brings him a little more anxiety and more isolation, not wanting or even know why. He has a neuropsychotherapist, and he works with the neurologist together.
Yeah, I think this is something that's really common. And, you know, I imagine your 28-year-old is not alone in feeling that way, because there is an unpredictability to epilepsy. And so every single time something like that happens, your brain is going to say, great, when is the shoe going to drop again? When am I going to feel this way again? You know, it's not a pleasant feeling whatsoever. So this is a really common thing that happens. And at the foundation of it all, what I feel is most important is our sense of belonging. So if every single time we have an epileptic attack and then we start to isolate more, we become less and less part of a community and less part of our friend group or our family. So it's really important to have a sense of belonging, especially if you have a chronic medical condition. And it doesn't have to be a sense of belonging within the epilepsy community, although I certainly recommend that. But I would support any kind of group that's interesting to you. Maybe you like Dungeons and Dragons, or maybe you like to play games with your friends on the weekends. This is something that can actually, you know, foster your sense of belongingness and then improve your mood. And it gets your mind off of what might be so dangerous or what might be dangerous to go do. Also really helpful to educate friends family, and any other organization you might be a part of. So that way, if something were to happen, that you feel safe knowing that they know how to manage that.
Yeah, that's really good advice. Another question did come in. Are support groups good for starting to build a community?
Absolutely. I think everyone should be in a support group. I know there are a lot of like epilepsy organizations that have support groups available to patients. And then I think that having, again, that sense of belongingness and knowing that other people are going through what you're experiencing, or at least relate to what you're experiencing, is huge. I can't recommend something like that enough.
Yeah. And I would certainly add on to that to reach out to your local epilepsy foundation or epilepsy serving organization to get recommendations for or information about support groups and support networks.
Absolutely.
Okay. All right. I think that that is the end of the questions there. So thank you again.
Yep. No